I'm here with Dr. Ed Johnson, who I've convinced that he needs to share his feelings around patient medical records and why you should keep your own medical records.
Well, John, I've been a family doctor for going on 40 years now, and I've been involved with taking care of patients since 1968 when I worked in an emergency room in a hospital outside of Detroit. And I'm thinking, everywhere I've been since that time, we've kept records of every lab test, x-ray, operative procedure, discharge summary, consultation. And now, having been a primary care doctor for at least 35 years, I've come to understand and appreciate the value of having information about patients, specifically their past history, what has happened to them. Having been grown up around Detroit, I use the analogy of a used car a lot with my patients, and most men in America know more about the history of the used car that they're driving than their own medical history, which I find somewhat humorous. But in any case, I've come up with what I like to call the ABCs, D's, E's, and F's of why the advantages of having access to your records and patients actually keeping these records and having them readily accessible when they need them. And accessibility is the key. People talk about improving medical records by having a uniform electronic medical record. Well, that's well and good, but that's years down the road, very costly, and we can have immediate accessibility to our own paper record today if we're so inclined. And if people understood that access to your last EKG tracing to compare with your current EKG tracing and access to your last CBC to see if anything has changed. People, ever since the HIPAA Act was passed in the early part of this decade by the federal government, having access to your medical records is not only okay, it is your right. And most people figure their healthcare provider, their doctor, their cardiologist, their urologist, their whateverologist will be responsible to keep this information. But when you travel to Florida for the winter or Arizona for the winter, or you're on vacation in the Bermuda or France or England or Italy, and you have your heart attack when you're 65 years old, and this has happened to many patients that I've taken care of, it's very interesting when they have their own medical record to compare with. So having access to your healthcare record will generate better care. So A leads to B. Good, accurate, accessible records in the possession of each individual person as they travel about this country over their lifetime leads to better care, especially when you can produce it in a timely fashion when you need it. A complete medical record, the records of when your last immunizations were, the last operation you had, the last lab test you had, the series of things that have done to you. I mean, you can't believe the number of patients who've had surgery, major surgery, for which they've been anesthetized. 10 years ago, they don't even remember the name of the surgeon, the name of the hospital, or the name of the procedure. All they remember is they got out alive and they're doing okay today. It's ludicrous. But a complete medical record, given the reason why you went to a hospital, what was done to you in the hospital, an operative report, a pathology report, all of these things are generated and they're all stored somewhere. People don't understand the value of these records when it comes to them and the continuity of their care. And that's the C of medical record keeping, is continuity of care. The whole timeline from birth to death. I call it cradle to cremation. There's a lot of data that occurs. This will help avoid the D word, duplication. Duplication of tests, duplication of x-rays, duplication of having to go over your history time and time and time again as all the subspecialists are called in to work on your various body parts that are failing. Duplication of tests can be avoided and create an economy of care. It's more efficient to take care of someone without duplicating studies and tests that have already been done or are done in the recent past. Errors in prescription writing, errors in between patients going from one pharmacy to another pharmacy to another pharmacy. Who keeps track of all of this? Generally speaking, your family doctor keeps track of this, but the patients that come into my office and they have a list, often it's a computer printout of their list of what they've been on and what they are allergic to and what they've tried and what they tried for their blood pressure 10 years ago didn't work or had a bad reaction to. It really helps streamline and make the care of these patients more efficient. Then again, the last thing that I would like to talk about is the F of healthcare. We don't have an F, G, H, or I. We skip right to R when it comes to the alphabet soup of healthcare. R is responsibility. Patients need to start taking responsibility for themselves, asking questions. How can you ask questions about something which you do not know? If you know because you have the record. It's the provider's responsibility to explain that to you. But if you don't take the responsibility of having that information, what's your primary care, family doctor's consultant supposed to know? So responsibility is there at many, 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 many levels, but it starts with patience.
Excellent. Ed, thank you.
Is that reasoning? Does that make sense?
It makes sense to me. I mean, we could wait another 20 years for them to get their electronic medical record thing together.
And this does not have to be mandated by the government. This does not have to be mandated by your insurance company. It does not have to be told to you by your primary care doctor. You have the right to do this today, and it will improve your health care tomorrow.
Is there any downside? I mean, what do you want these records for? I can just see these people asking and worrying about that.
The downside is the ignorance on the part of the healthcare medical industrial complex. I have given my patients their records. They take them to the emergency room, and honestly, often the reaction is, why do you have this? Because not that it's wrong or doesn't make any sense, it's just they're not used to people taking responsibility for themselves. And if you will take the responsibility to research out the different models of cars you're looking at to buy in the near future, why can't you take the responsibility toward being an informed consumer and a critical consumer of the health care that is being either provided for you or bought with your own hard-earned dollars? But ultimately, you will benefit if you take this initiative.
Excellent. Thank you, Ed. Thank you very much for taking the time to tape this with me.
You're welcome.